Well, it's key, excuse me, it's key to all of the duties that we were just talking about in order for people, the skiers, for us to do our part. And it's a national code, started back in the 60s with the National Ski Patrol System before they had professional ski patrols at ski areas. And it's used all over North America. Something called the Alpine Responsibility Code. It's very similar. It has a few more details on it. I've testified in trials in Australia talking about a code that they have is skiing. You know, skiing is very dynamic, as you know if you're a skier. And so you're trying to put some basic rules in that people can follow. They're common sense. And, oh, go ahead.
Do you know, are there ways that skiers can become familiar with this responsibility code?
Yes, this is published at all ski areas. It's on trail maps typically, and you'd find them on big trail signboards too at the ski area. Websites will have it. There's all sorts of places you can go to find this, but it's everywhere.
Okay, and let's talk about the particular points here. I'll pull them out. Maybe should we just go through them one by one? Is that okay?
Sure, however you want to do it.
Okay, so the first one, always stay in control and be able to stop or avoid other people or objects. That seems fairly common sense.
Yes, that's if that one doesn't work, the rest of them aren't going to work.
And the second one maybe is more important. People ahead of you have the right of way. It is your responsibility to avoid them. Can you explain what that means for skiers?
Yes, and the presumption is when people are skiing down a run, the people in front of you aren't going to have that rear view like you would. You'd be in a better position as an overtaking skier to see the people in front of you.
Got it. 3 is you must not stop where you obstruct a trail or are not visible from above. What does that mean?
Well, again, it's just about being visible. And so if there's a breakover in the terrain, you are on the bottom side of it, the skier that's coming from above isn't going to see you. And so it's to prevent surprises. And again, if you're skiing in control, if you're following the first rule, when you're coming, that's what allows them, even if they come to a terrain change and there's let's say a small child following the code, you're not following it either if you just go tearing over the hill. You have to be able to be in a position to maneuver so you don't hit anything.
Okay, so if a skier were taking, are you familiar with the term GS turns?
Yes, giant slalom.
If a skier were taking GS turns, what principles here should that skier follow?
Well, with a GS turn, and again, just backing up for a moment, skiing is very dynamic. It's people are mentioning one of them, you know, short radius turn or a slalom versus a larger radius turn, more rounded turn, a giant slalom. Shorter radius turns, that would be a reason. But typically when people are skiing giant is usually faster. And people that are skiing short radius turns, I mean, if they try, they can ski quickly, but most of the time the turn is what controls your speed. So if you're making more of them, you're probably going slower.
What about, let's assume a skier is overtaking another group. They're skiing through a group that's skiing slower. What responsibility is that?
People ahead of you have the right of way. And when you're coming into a group, you now have less space to maneuver. And your lookout has to be sharper because you have more things to focus on. Again, remember, everybody's not moving in unison. They're moving dynamically, and people can turn suddenly. And so again, if you're a prudent skier, and this isn't necessarily covered in the code, but if I'm going to make an abrupt turn on a crowded run, that's a problem. You need to look up. You know, it doesn't say you have to look uphill, but so the code gets you just so far. And I think, if I may, one of the things about the code is if you try to look at any one rule and say, for example, in a collision, because I have to look at this all the time in these investigations, or when I'm training people, I would have to tell them, never focus on just one. That's just one part of the puzzle. There's usually something else. And if I had a penny for everything that was involved, the failure of the lookout. For example, if I might have two skiers in a collision, and both are trying to be not the uphill skier, and I look at them and I'm going, but you were changing your positions, you had different speeds, you were merging and converging on each other. You both have the responsibility for your lookout. It can't just be straight ahead. You have to be looking, and that's part of why you have to go to number one, and that's the king. And then you go through the rest of them, but you can't hang your head on just one. Now, in some accidents,
is there anything about what can you tell us about the rules of skiing reasonably that relates to skiing within your ability? Is that one of the rules?
well, it's not a rule per se, but it is right here that you have to be in control. So that means you need to then, it's not that different, I guess, from driving there, because, you know, if the weather's bad and your braking distance is bad, then you have to give more room. And I think creating space is a key, but you have to ski within your ability, and you want to assume that
Responsibility to take account of those disability or those limitations and ski appropriately.
yes, of course.
Let's move away from this for a second and ask you about a hypothetical that was correct. And he talked about bindings releasing. Do you remember that?
Yes.
And do you have knowledge about how bindings release in ski collisions?
Yes, I do.
So if you were to assume a certain skier came and hit another skier directly in the back at a high rate of speed, would you expect bindings to come loose, the skis to come off the skier?
Objection, Your Honor. My foundation also in his report in the lease, there is nothing mentioning any binding release anywhere in the report.
Sustained.
Let's take another hypothetical. Give me a second to think it through. Hypothetical of someone skiing directly into someone else's back. Would you expect that person to launch over the person they hit? Is there a space on the hill where, if a skier were trying to avoid collisions and ski in a kind of safe and cautious place on the hill, where should that skier go?
Well, you could look for certainly terrain within your ability, and if you want to be cautious, you'd probably want to be on easier runs. And if you were wanting to be away from more collisions, and runs are getting crowded these days, you know, you pick the right time, or you wait for opportunities. You can wait for traffic to go by, and then you can go. Staying on the margins of the run is usually good, because you only have one side to defend, if you will.
So if a skier were taking short radius turns on the right side of a run, would that be within the parameters you've just described?
Yes.
I did cut you off a little earlier when you were talking about the inherent risks of skier collisions, the things you learned about what. Is there anything else?
Well, I mean, that's a big question.
Objection, vague.
Okay, Your Honor, may I take a second to consult with my counsel? Thanks. Sure. personally went to the site of this collision, correct?
I did.
And were you there when Mr. Brill, maybe I should ask first, do you know Mr. Brian Brill?
I do.
And who is he?
He does animations, the ones that you've been seeing here, and he does them all over. For ski accidents, I think he does other things too, but he's very, very precise in laying out the terrain and the features in the terrain. That, the trees are all the right height, the shadows are correct, and all of that.
Yeah, and you were here, and you'd seen the animations before, correct?
I have.
Objection, Your Honor. This goes beyond the scope of his report. There's no mention of animations in the report.
Overruled at this point.
And-
I need to see how it's tied in.
Sure. I was just going to ask that given that you've been to the site of the collision, does the animation you accurately portray the location?
Objection, Your Honor.
Sustained as to relevance, it doesn't matter. It was a demonstrative of the other witness's testimony.
Okay. In this case, what did you review?
I looked at all the deposition testimony, the documents, and various forms. We did the site inspection. I did work with Mr. Brill on the animations.
Relevance.
Sustained as to relevance. Why don't we take our lunch break at this time? It's just a little afternoon, and we'll take a recess and return at 1:30. Thank you.
Thank you, Your Honor.
Questions in light of the court's earlier rulings? Okay, 1:30. Thank you. No, I won't bring them in the room until they're ready. Mr. Bogger, you to the witness stand. Okay, we're ready for the jury. All right. Thank you. Mr. Egan, you may continue.
Thank you, Your Honor. All right, Mr. Bogger, we just have a few more questions, and then we'll get you off the stand here. First, is it your opinion that both Mr. Sanderson and Ms. Paltrow had the responsibility to exercise reasonable care to avoid a collision with each other on the day of their accident?
Yes, that's correct.
And you're familiar with Ms. Paltrow's account of that collision, correct?
Yes, I am.
Have you heard her?
Yes.
And if you assume that her account is correct, is it your opinion that she did comply with the standard of care or the reasonable standard that you just said that was her duty?
Yes.
And you assume her account was correct. Did Mr. Sanderson comply with that duty?
No.
And why is that?
Well, if you assume the facts that we're looking at Ms. Paltrow's version, then you'd have to conclude that at the moment of the collision, she was a skier below and was hit from behind. And that collision, I know I said there were a lot of other factors, but in this case, that seems to be the key factor, and that's where the failure of someone's lookout at the last minute, even if they can be in control the entire time, making great slalom turns, whatever it might be. But you can be a very good skier, then you have a collision. And by definition, if you have that collision, that's not in control because you can't stop and or avoid anything below. So by definition, that's skiing out of control, even if it's momentary.
Did you review and do you have knowledge of the standards for ski resorts in terms of that kind of a investigation of an accident?
Yes.
And did Deer Valley comply with that standard?
Yes. The facts that they had in front of them, yes.
And did you see any evidence of inappropriate documentation?
No. What I reviewed looked like it would meet the industry standard of care. It would be very similar to all the ski areas that I visited and know I'm familiar with their record keeping and so forth. These are typical business records kept in the course.
In your experience thoroughly investigating over, I think you said 500 ski collisions, do you sometimes conclude that the evidence does not allow you to determine who is at fault?
All the time, yeah. Sometimes you just don't have enough information. Sometimes you have conflicting information, and you just, there's plausible versions, and you can't know which one's right, and you just have to realize that you're not going to be able to determine fault. So that's common enough.
Okay, that's all my questions. Thanks.
Thanks.
Ms. Van Orman?
Good afternoon.
Good afternoon.
I'm going to be really, really quick with you. In fact, we're just going to do the opposite of what you just testified to. So you were just asked if Ms. Paltrow's version of the accident, assuming that was true, would Mr. Sanderson have violated the skier's responsibility code? We're going to flip that. You've heard Mr. Sanderson and Mr. Ramon's version of the accident. Assuming those were true, they would have complied with they all have to follow it, right?
That's correct.
No matter if somebody has a disability in their eye or if they're turning to look at their children to watch them ski.
All skiers have that responsibility at all times.
Thank you.
Thank you.
Mr. Egan?
That's all, Your Honor.
Thank you. And Mr. Bogger? You may step down. Mr. Egan, you may call your next witness, or Mr. Owens this time.
Thank you, Your Honor. Stephen Edgley, MD. So, Dr. Edgley, the court wants to swear you to tell the truth. There's a lot of stuff here.
Do you swear that the testimony you truth and nothing but the truth, so help you God? Thank you. You can have a seat.
Good afternoon. Would you begin by stating your full name and spelling it for the jury?
Stephen R. Edgley. That's a Stevenedgley. Yep.
Okay, Dr. Edgley, are you employed?
Yes.
Where are you employed?
At the University of Utah.
And are you over the acquired brain injury division?
Yes. Physical medicine and rehab is my specialty, and I'm over that section.
How old are you, sir?
49.
Okay, and just background, undergraduate degree, where was that?
I studied psychology with a pre-med emphasis at BYU. My med school training was in Chicago at Loyola University in Chicago. And I did a 4-year residency in physical medicine and rehab at the University of Utah.
And then, did you go there? Did you stay at the university?
Yes.
And have been for how many years?
Overall, 20, yes.
Okay, and do you hold an endowed chair at the university?
I do.
Do you teach? Are you a professor there?
Yes. So I had a stroke in 2001, 21 years ago.
And
For a residency training in ophthalmology, actually. I took 1 year off to deal with the recovery and training.
are you board certified in your specialty?
I am.
You are. Do you deal with people other than stroke people, other acquired brain injuries?
So in my practice, it's a very busy practice. 95% of my practice deals with acquired brain injury.
And what is that? As opposed to brain injury, like if a baby is born with a brain injury, that's
It's
not acquired, right?
Acquired. So acquired brain strokes, traumatic brain injury, concussions, and a myriad of other brain injuries related to surgery, anoxia, near drownings.
A child who's found at the bottom of a swimming pool, rehabilitated, brought in, and they come and see you.
Yes.
About how many patients have you seen in your career?
So I have, let's see, I see about 15 separate encounters per day over 20 years. That equals over 65,000 patient encounters of acquired brain injury.
Thank you. And do you consider yourself an expert in brain injuries?
Yes.
And the fact that you only had an acquired brain injury, does that also give you additional insight?
It makes me kind of unique in that I have experienced.
Have you
Yes.
reviewed voluminous records in this case?
I have.
So the court complaint, records and reports from the VA hospital,
Yes.
and deposition transcripts, Gwyneth Paltrow, Terry Sanderson, the daughters, Sam Goldstein, Dr. Fong, all of those.
Yes, that's correct. Yes.
And medical records also of the Park City Instacare, Cognitive FX, Sam Goldstein. Have you reviewed those?
Yes.
Do you believe that you have the foundation to render expert opinions in this case? The jurors have already heard that the patient, or I should say Mr. Sanderson, has a mild traumatic brain injury. Do you agree or disagree?
I think I have pored over the records. These are inconclusive.
Did you tell me that the most important things you look at are how long they're unconscious and how long they've lost their memory, amnesia?
That's correct. So that's going by the Cantu concussion grading system, which is preferable because it's the most objective and not relying on subjective symptoms from any patient.
Okay, so a concussion, if you hear someone has a concussion, are those your two lead questions? How long were you out, and how long is your memory out?
Exactly.
All right, and apply that to Mr. Sanderson, would you?
So it is unclear whether he lost consciousness. Now, let me be clear. So when you are unconscious, you are totally lifeless and limp, not speaking, not moving. That's unconsciousness. The records, there is a very inconsistent evidence that he did in fact lose consciousness. So I am not.
For instance, Christensen was the ski instructor. He testified to no loss of consciousness. You with me?
Yep.
And Brad Falchuk has not gone yet. Ms. Paltrow has stated no loss of consciousness. Craig Ramon did say loss of consciousness. Have I sort of summarized some of the people who talked about that?
Yeah, and the plaintiff himself has said, loss of consciousness, 5 minutes, and then again a later 10 minutes.
Okay,
Yes.
so Mr. Sanderson kept changing what he
Yes.
was telling people, right? I don't know, a few seconds, 5
Yes.
minutes, then 10 minutes. True?
Yes, and I think that is why it's important with the post-traumatic amnesia. So, the plaintiff will not remember how long memory he had of that event.
Okay.
And-
So consciousness, I heard you say 5 minutes, and I just want to be clear. One of the ways we rate sort of the severity of the concussion is very short to no concussion, up to 5 minutes, and then over 5 minutes.
So
Is that true?
So to clarify,
Whitney Smith, I guess, was another provider who said no loss of consciousness. Are you aware of that?
I don't recall.
Okay,
Yes.
Whitney was the toboggan person.
Yeah,
and
okay.
She asked, she quizzed them, I guess, but let me move on. Okay, so even if Ramon's testimony is believed, that would put him only in the second category, less than 5 minutes.
Yes.
Okay, and first category is essentially no loss of consciousness.
Yes.
Okay, now let's go to amnesia. Applying what you've learned about Mr. Sanderson, how long was his amnesia after the collision?
That is also very ambiguous and multiple reports. I hear and read Eric Christensen, which he does remember, which was traumatic. And
True?
so,
Is that what you're referring to?
yes, that is the allegation. Yes.
Okay, and he remembers his friend Craig Ramon talking to him. Are you okay? Okay. True?
Yes.
Okay, so what does that tell you about length of amnesia?
It was brief, if at all.
Okay. So you said that two big things we look at for severity of concussion is how long they're out and how long they can forget things.
So, people experiencing brain trauma of fogginess and as the plaintiff himself said, quote, I rung my...
Okay. At one point he said, I rung my bell. I hear you. Go ahead.
So I am not able to say, it is probably, it is likely that he did have some confusion. But if loss of consciousness and no post-traumatic amnesia, it can't really be called a concussion.
All right, fair enough. And confusion, let's just talk about that issue. He has memories at the actual incident.
I understand an objection, Doctor.
Period of confusion. Do you remember what he told the toboggan person, Whitney, about whether he... Do you know what Whitney observed in terms of his confusion level?
No.
Okay. She wrote alert and oriented times 4 or something. That's in evidence. I'm asking now to comment on it.
Overruled?
No foundation.
Overruled?
If Whitney, the toboggan person, observed no alert and oriented times 4, are you familiar with that term?
Yes.
And is it 4 out of 4?
Yes.
Like 4 is the best score?
Yeah.
Yeah. I want to know what that scale means. Please tell me.
So let's see. Oriented to person, place, situation, and location.
Place, time.
Time.
I don't
Yes.
know. I don't know. Okay.
Person, place, time, situation.
Did you say president or present?
No, person.
Person.
So-
person.
so-
Gotcha.
So
All right. And the jury's heard on those issues, so that's okay. I asked Terry, would it surprise you if at the Instacare they found no... is that consistent with your knowledge of the events?
yes,
Have you seen texts he was sending out even at the bottom of the hill about Whitney?
Overruled?
Go ahead.
the text. Yes.
All right. Is it your opinion that if Mr. Sanderson suffered a concussion and it was mild, it was
Leading.
mild?
Leading.
What's the question again?
Is it your opinion that if Mr. Sanderson suffered a concussion, it was mild?
Yes, it is. Yeah.
And is that based on the things we've been discussing, or are there any other issues? Fusion.
Sustained?
I'm just wondering, are there other issues we ought to hit before we move on to your next opinion that go to that issue?
A helmeted low velocity. Also,
Low velocity impact. What does that mean?
so he was not going fast.
Okay, what do you know?
Like in a car accident. He was not going car speeds.
Okay. And you, for instance, the depositions where they discuss it was actually kind of a slow fall,
Yes.
and that's important when determining how hard the hit was or something for the concussion severity.
Yes.
Thank you. Any other factors we've missed?
I don't think so.
All right, let's go to your second opinion here. None of the medical records support plaintiff's claim that perceived symptoms of cognitive decline are related to the ski collision. Is that your opinion?
Yes.
Maybe
it
I'll
is.
flip it around. Comment on his symptoms. What percentage of his symptoms that he now complains of are related to the ski collision?
I analyze what he had going on in his brain before and after the collision.
Please do that.
So the plaintiff, and I'm in no way trying to pick on the plaintiff, but he had a number of brain conditions. He had a stroke, which he lost his eyesight in his right eye. And probably most importantly, he had evidence of a hydrocephalus clear back in 2009, and the hydrocephalus and
Okay, let me make sure we get the whole list, though. These are preceding brain problems from his pre-collision, true?
Yeah.
Are we showing this, whatever this exhibit is, to the?
But please turn it around. It's a different topic.
Go ahead.
so
That was not a prop. That was getting ready to show it, but we'll go on.
yeah, okay. Restate
Yes,
that.
thank you. Okay, I heard you say, with regard to pre-collision brain problems that the plaintiff had, stroke, microvascular disease, hydrocephalus. Any others?
MRI of his brain in 2009.
He had a history of migraines. Is that something you'd put under that list or not?
Yeah. Yes. So
Sustained?
Okay.
Pardon me?
I didn't even
Strike.
I couldn't hear. Just
move
okay.
to strike the answer.
Motion granted.
I didn't even know what his answer was going to be, by the way. I'm just trying to get this list together. But
The answer is certain the jury must disregard it.
thank you. So if you think of another one we ought to talk about, please tell me, okay? You said you want to talk about cephalus. What is that word?
where the ventricles have too much pressure, or a condition called normal pressure hydrocephalus, which is equally kind of devastating.
Dumb it down for me. Does hydro mean water?
Yes,
What does cephalus mean?
brain.
Okay,
Yeah.
so this is very confusing. Normal pressure hydrocephalus is not a normal condition. Is that true?
Not at all.
Overruled?
It's. I mean, when I see the word normal in a diagnosis, I think, oh, that's normal. But in this case, normal pressure hydrocephalus is or is not a good condition.
So it is a well-recognized medical condition that is only 1 in 500 people between the age 60 and 70 have this, and it gets worse with that time.
You said hydrocephalus means water brain. What does that mean? There's too much fluid in the head, or what?
It specifically means that there is too much fluid in the ventricles of the brain. Cavities that feed the spinal column and eventually get resorbed by the body.
And you said it's progressive. Comment on that. So let's say there were no ski accident. Comment on its progressiveness in Mr. Sanderson.
So it's been 14 years since that initial MRI. That time, I would expect symptoms to crop up like loss of memory, like trouble with balance.
Microvascular disease, by the way, I want to know if these things are related. If someone has the hydrocephalus like Mr. Sanderson, does he have to have microvascular disease?
No.
All right, and do you believe the microvascular disease caused the stroke?
Yes.
Okay, so those two things are related.
So
go ahead.
So a stroke of the strokes and a indication that
Micro means small. Is that right?
yes,
Vascular means like blood flow.
yes,
All right, so small blood flow. So in lay terms, does that mean the passages of blood flow are narrowed in his brain?
yes.
Sustained?
I'm trying to get to the most on Mr. Sanderson's pre-collision brain as it related to microvascular disease, please.
So 2 points. So some microvascular disease can cause very small strokes, which are not able to be detected by scans, MRI, CT. Also, number 2, microvascular disease is a great risk factor for future risk.
Is this your opinion? All symptoms the plaintiff claims is explained not by the collision, but by his pre-accident conditions. I'm trying to get his opinion out there, Your Honor.
You can ask what his opinion is.
Yeah. Sustained.
Claims as it relates to his pre-accident conditions.
So, in a more likely than not scenario, in this 76-year-old brain now, concussion symptoms should only last there is a wide berth of evidence that when the concussion symptoms last for longer than 3 minutes, highly correlated with monetary gains or litigation.
explain that, please? Monetary gains or litigation? Go ahead. What's your point? And relate it, please, directly to Mr. Sanderson.
Your Honor, this goes beyond the scope of his expert report.
Could you approach, please? Objection sustained?
Describe the answer to.
And the answer, question and answer will be stricken, and the jury is ordered to disregard it.
Comment, would you, on the patient's pre-existing anxiety and depression?
So he has been medicated for a number of years for depression.
And just comment on that, would you?
So also, when symptoms of concussion last for 3 months or longer, anxiety and depression and other psychiatric conditions are the likely cause of that prolongation.
The last sentence? I missed the last word, I'm sorry.
Prolongation.
Prolongation.
Yes.
Thank you for explaining that. Can you a little further about that? What do you say it a different way for me, would you?
Yeah. So the symptoms of a concussion should last no more than 3 months. When the symptoms of concussion last longer than 3 months, you start looking for, and this is highly and other psychiatric conditions.
One thing you noted in your report was plaintiff has a history of seeking medical attention at 2 times in 10 years. Is that your opinion? Well, comment on how frequently Mr. Sanderson went to his doctors in the 10 years prior to the collision.
So I did note that he had an extensive history of seeking care.
And what does that tell you? Why is that important?
2 things. One, either he has many medical issues before the collision, or he is kind of hyper focused on his symptoms.
And that's just as a part of aging, did he note a decline in his mental or physical activity acuity level?
So what's is within 1 month of the collision, he went to his own family doctor and said, I feel like I'm getting old.
This is within 1 month before, correct?
Yes.
And did he say, I'm having a heart he's done?
Yes.
Bleeding.
Overruled.
And why was he feeling that way? Do we know?
I
Hearsay, Your Honor.
yeah. So I
Sustained.
I'm just asking, do you have any thoughts on that issue?
Hearsay.
Sustained.
Well, using your medical opinion, I'm just wondering, what does that tell you as a reviewing medical expert?
Foundation.
Overruled.
Go ahead. I'm getting old and I can't do what I used to do. Go ahead.
he the same thing. Yes. And I think with time it accrues conditions, problems, just like any other organ. The plaintiff had evidence these disease processes before the clinician.
Okay. And this was the stroke workup. Is that where he had the imaging
Yeah.
before? And do you know of any of their plaintiffs' experts who actually reviewed the stroke imaging before collision?
Foundation, Your Honor.
Okay. Did any of the plaintiffs' experts review the imaging to your knowledge?
Not to my knowledge.
And if we're trying to figure out, hey, what's this guy's brain like before and what's this guy's brain like after, it would be nice to put those side to side, wouldn't it? And actually compare?
It would, and that's what the defense has done. Yes.
All right, let's just talk about aging. Have you seen? May I show him a document, Your Honor, before I publish it?
Sure.
Have you seen Defense Exhibit 103 and 103B?
I have.
And does that appear to be a true and correct summary of Mr. Sanderson's health before the incident?
It does.
Okay, and Your Honor, Musha?
Any objection?
We object, Your Honor. It's what we've talked about before. There's irrelevant medical information there.
I'm about to establish the relevance.
If he hasn't established it yet.
I'm going to admit 103 and 103B for demonstrative purposes only to allow this witness to illustrate their testimony.
Figure out how to show this too.
There's an easel somewhere.
Is this okay for a minute?
Sure.
This is the same thing, I just don't trust technology. So 103, and Doctor, do you have a binder right in front of you? Do you have a defense binder?
Yeah.
May I Oh, can you see it right here?
Yes.
Oh, the monitor. It threw us the first week that the monitor wasn't working. Can you do the first third? All right. Can you see that okay, Doctor?
Yes.
And is this the note you were just talking about? Thinks he's gotten old all of a sudden, not doing things he used to do?
Yeah, it is. Yes.
And then, let's say that big. Then, blind in right eye. Were you familiar with?
I was.
And severely impaired in the other. Did you see that in his medical records?
I did.
did you see evidence that he walked into walls before the incident?
Yes.
He would ask people standing on the right side of his field of vision to move so that he could see them. Did you see that in the evidence?
Yes.
One of the reasons he retired was because he had a stroke event that deprived his eye of oxygen, impacting his vision. Did you observe that in the evidence?
Yes.
If we're going to go through all these, it's going to be leading, Your Honor, every time.
Overruled.
He adjusted his skiing to one side of the slope to try to avoid hitting others in his blind spot. Did you observe that?
Yes.
He had to be picky about what days he skied to avoid days with lighting that would further limit his depth perception. Do you agree? You see that in the evidence?
Yes.
By the way, I mean, if I close one eye, do I have depth perception? Is it still three? Comment on that. Is it still three-dimensional or is it now two-dimensional?
You don't
He's commenting about aging.
Overruled.
Okay, so I'm closing one eye. Does that hurt my depth perception or it doesn't?
that does.
Just comment very briefly.
Well, you have basically got a monocular situation, and so depth perception will be severely impaired.
Prostate cancer, were you aware he to this day still has metastatic prostate cancer?
Yes.
It's not like it was cured, true?
Yeah.
And he is severely hearing impaired. Did you see that in the record?
Yes.
He has difficulty hearing higher frequency sounds like a woman's voice. Did you see that?
Yes.
Hearing loss is severe. Did you see that?
Yes.
Heart palpitations. Did you see reference to that?
Yes.
And he was 2 heart medicines, 2 heart, just prior to the ski collision, 2 blood pressure meds for his heart.
Yes.
Is that related to the palpitations, or are those high blood pressure issues separate from the...
They can be related to anxiety.
Okay. Do you have an opinion one way or the other?
So I cannot speculate.
Okay, Mr. Sanderson is 76 years old and experiencing the effects of aging. Do you believe that?
We all are.
Is that a yes?
Yes.
Microvascular disease, we talked about that. Moderate diffuse volume loss atrophy, brain volume decreasing. Did you note that he had that prior to the ski collision?
So it on the report, yes.
Okay. And what does that mean?
Some more than others. And
Talk about Mr. Sanderson, please.
brain atrophy can be caused by a number of factors.
Okay. Comment on Mr. Sanderson, please. The ski collision.
We don't.
Speculation.
That's
I
what
don't know
I'm
why
asking.
he had it before.
I'm asking if he knows it.
Overruled.
Tell us if you know why he had it.
Caused by a number of things. Commonly, people who drink alcohol excessively commonly have brain atrophy. But there are a number of other causes.
Did you see any evidence in the VA record that he sometimes drinks more than 6?
I did.
And did you see the advice from his providers was, don't do that anymore.
I did.
We want you to abstain from alcohol. Yes?
Overruled.
We're going to move faster here. By the way, it says moderate volume loss. So mild, moderate, severe, are those sort of the 3 categories?
Yes. and that's referring to the MRI in 2009.
Retinal artery occlusion. We talked about that. That's the eye thing. And clotting in arteries delivering blood to brain. Is there anything you want to comment that you haven't talked about on that issue, number 9?
No, I don't think so.
Depression, you've talked about that. Anything more you want to say about it?
Depression and anxiety.
Okay. If he says, since the ski collision, I've had more depression and anxiety than I did before, what do you attribute that to?
So, any symptoms past 3 months, I would attribute it to this multiple factors, not at the accident.
Okay, migraine we've talked about. Let's go. We're going to march through these very fast. To going now, starting on 103B12. Did you know he had degenerative disc disease in his back prior to the ski collision?
I did.
Did you see reference to a foot drop, that he, at least for a time, he actually was dragging his foot?
I did.
Weakness in
Yes.
see that? Knee injury, yes.
Yes.
And that was actually from a ski collision? Do you recall this? Not a collision, a ski accident.
I did not know that. Yes.
Shoulder injury, shoulder problems. Do you recall him having those?
Yes.
And hamstring injury, right? Torn hamstring.
Yes.
Osteoarthritis. Did you see that?
Yes. And what may be more relevant to this case is the osteoarthritis in the neck region, which would make moving your head side to side kind of painful or difficult. That, along with the vision impairment, are, I think, relevant.
All right. My partners here are telling me I should wind up. Can you at least look at insomnia, respiratory problems, poor male sexual reproductive health, lower urinary tract issues, kidney problems, hypercholesterolemia, weight gain, and restless legs? Are those all conditions you saw in his pre-collision medical records?
Yeah.
And why are these things important when we're talking about aging?
It is a long list. Some of these conditions are more relevant than others.
Fair
but the indicates that he is 76 and sometimes I have multiple medical conditions like this.
And these are all pre-collision events, right? Pre-collision conditions.
Yes.
And what does that tell you in terms of his aging, like at 69?
Well, so like I said before, we all are.
Aging.
Yes. And so in terms of the brain as an organ, we talk about brain reserve. And we talk about cognitive reserve. Brain reserve tends to go down and down starting at around age of 25. It goes down faster.
Okay.
Cognitive reserve indicates that the patient's ability to cope, adapt, be resilient, and find effective workarounds for that brain decline, which we all are going at various stages.
Let me conclude here. They're about to stand up and criticize you for not personally meeting with the patient. The VA, Veterans Administration people. What did they show on all their neuropsych testing?
So I did not press to actually meet and examine the plaintiff because to go over a totally normal physical exam as well documented records.
And they documented high, average to superior in essentially all categories.
Sustained.
Can you comment?
So I think you're referring to the neuropsych test.
Correct. Just give us, and then I'm sitting down. Give us a couple, 2 sentences on that, would you?
So a neuropsych.
What was it as to Mr. Sanderson after the collision?
He had 3 neuropsych tests, and it was superior to above average.
Thank you.
And
Those are all my questions. Thanks.
We'll take a short recess right now. Thank you. You can step down. We'll take a 10-minute break. 10 minutes.
While the jury is not here, may I mention an issue?
Yeah, have them stop at the door. Go ahead, Mr. Owens.
So after this witness, there are 3 witnesses who haven't been able to testify, and so they're going to testify by deposition. Are they ready to go to Oaks? Because we withdrew that one, but we want to know, are they ready to go?
We can be ready.
And,
Yes.
and are you reading our parts too?
I don't know what your parts are, but.
We handed them.
Yeah, we got them about 15 minutes ago.
Right. It's just a matter of reading them, though. I just need to know, because otherwise,
What was the last question? I didn't hear
can we
you.
just do it all on paper, the reading back and forth? We don't have time to review their
Mr.
video.
Sykes, are you fine with?
Right, but we're talking about like, we're going live here.
Right, and we've handed this to us, 15 minutes ago. We gave them our part a couple hours ago. We'd
Well,
like to.
James is right here. I don't know who.
Well, did you talk to Kristen?
I did not, but as I understand, Kristen is
We're-
amenable to reading it.
We're
Is
trying to
that
get
correct?
Dr. Bain. We're going to
They-
we'll go along with that if we can get Dr. Bain, but I'm not sure we can even get Dr. Bain except
Get
for
Kristen in here, would
for
you?
2 o'clock for sure tomorrow afternoon.
All right. Well, let's finish with this witness, and in the meantime, maybe it'll sort itself out. If not, I'll have to make a decision.
I'm trying to contact Dr. Bain right now.
Okay. Let's have the jury come in. Mr. Sorensen?
Dr. Edgley, thank you for being with us today, and you've overcome a great deal to be able to be so accomplished, and we appreciate that. I'm going to go through a few questions pretty quickly, and I just ask if you wouldn't mind answering them yes or no. They should be yes or no questions, and I think we can move this process along. Is it true, or is it the case that you're paid $500 an hour for records review and $700 an hour to be here?
I believe you have that information, and that is correct. That there is an opportunity cost by my not being at my regular practice to offset the opportunity cost by my not being at my regular clinical practice.
Gotcha. So that is yes, though those numbers are correct.
Yes.
Okay, thank you. And is it true that, and as defense counsel pointed out, you did not ever meet with or see Terry Sanderson, correct?
Yes.
Okay. So you were paid to review records and do sort of a forensic records analysis, correct?
Yes.
We went over what you had reviewed in preparation to give and offer your opinions, and I didn't see that you ever reviewed. Is that correct?
I don't think they were ever given that to me.
Okay, so that is correct. You did not review them.
I don't think so.
Okay. What
Of Dr. Gibby. No, I was not.
Okay. So is it your position that you did rely on some of Dr. Gibby's records to formulate the opinions you've offered so far?
Yes.
Okay. And I did also not see that you have the deposition of Whitney Smith, the EMT that we've heard from in this case. Is that correct?
I think that's correct.
Nor did I see that you reviewed the deposition of Carlene Davidson. Is that correct?
Who is she?
She's the plaintiff's offered testimony in this case.
So I did review her deposition.
Neither of those last two were on the list of things that you say you rely on, so you were in fact partially relying on them for your opinions?
Yes.
Okay. I think we already covered it, but you did a forensic document review in this case, is that correct?
Yeah, yes.
Okay. And in a nutshell, and I don't want to put words in your mouth, but you offered 5 main opinions in your expert report that you provided to us, is that correct?
Right.
And really, because of court rulings, we're going to focus on 2 of those, is that all right?
Yes.
Okay. Your first opinion that plaintiffs went, or defense counsel went through with you is that compelling evidence indicates that plaintiff's concussion was mild, and that you believe that there's a chance he did lose consciousness.
And there is a chance, but more likely than not, no loss of consciousness. I have not seen any compelling evidence to formulate otherwise.
When you say compelling evidence, you're stepping into the place of the jury to weigh evidence, isn't that correct? Is that a yes or a no? When you weigh and you say that it wasn't compelling, is that because you weighed evidence?
I read, poured over many reports, many which were, and I'm left to wonder, did he actually lose consciousness or not? I don't know. I would say more likely than not, the answer is no.
Okay. And for the reasons that you gave when defense attorneys were asking you questions, that's why you say that it was more likely than not that he did not lose consciousness.
Yes.
Okay, do you need to have a loss of consciousness in order to sustain a concussion?
No.
Okay. And is there into the actual definition of what unconscious means?
I don't think so.
So all of those that are in your specialty would say that a loss of consciousness involves, I don't want to put words in your mouth, but lifeless and...
Yes.
So if we've heard testimony before this that you can be unconscious or have a loss of consciousness but still be somewhat awake, just disoriented or not alert, that's not correct.
That's disorientation, not loss of consciousness.
Okay. Is it possible that the amnesia that you talked about with defense counsel is or could account for Terry Sanderson's lost consciousness?
Yes.
Okay. So that is a very real possibility in this case.
Yeah. You cannot comment on your own unconsciousness.
Gotcha. So then we would be forced to rely on the testimony of those that were there or those that reported what they had seen?
Yes.
Okay. We've heard some testimony earlier about a triggering event. Are you aware of things that could be considered a triggering event?
the concept, yes.
Okay. Caused by a triggering event.
No.
Okay. Is NPH caused by a triggering event?
No.
Okay. Can the presence of NPH exacerbate a concussion or the symptoms of it?
It can in theory, but only for a brief period of a time. Brief meaning weeks to months.
Okay.
Not certainly not 7 years.
Okay. And the jury's heard a lot of testimony about a condition called PCS or post-concussive symptoms. Are you aware of that condition?
Yes.
So is it possibly leading to PCS?
Let me back up. So, not already. Yeah, that the DSM-5, which is the list of psychiatric conditions. The fifth and most current edition says that a concussion lasts more than 3 months. Look for other causes, and I believe that they have totally eliminated PCS from their diagnostic manual.
So, and I don't want to misstate the answer you just gave me, but is it your opinion then that PCS and NPH are not related at all then?
Answer: yes, no. I cannot say that there is no small, association.
Okay, so when Dr. Bameford,
I would like to, so I have an issue with the term PCS. I think it's, so whereas it was a valid condition, it's not, at least in the psychiatric world, it's not recognized as a condition now.
okay, so, and maybe I inartfully asked the question, but essentially, again, I don't want to restate for you, but you're coming at this from a psychiatric perspective where PCS might be more of a clinical or medical diagnosis. Is that correct?
No.
Okay. Can anxiety and depression be risk factors for possibly having PCS?
Again, I take issue with the term PCS, post-concussion syndrome.
Okay, what about, and I think we're talking about the same things, but I believe I'm talking about post-concussion symptoms, and I don't know that they refer to it as syndrome anymore. Is that correct?
Yes.
Okay.
So if you want to talk about post-concussion symptoms, we can have a dialogue. Yes.
Okay. And maybe that's my fault for misstating it before. I'll ask you the same question then. Can NPH be a risk factor for post-concussive symptoms?
So NPH is a chronic degenerative disease that likely exacerbated by a number of things. The immediate aftermath of concussion being one of them. But more likely, much more likely than not, the concussion symptoms gone away, and what we're left with is a brain that has NPH, microvascular disease, history of stroke, and is 76.
Okay. And you said history of stroke. I want to make sure the jury's clear. Mr. Sanderson had a stroke-like event in his eye. Is that what you're referring to when you say stroke?
Let me be clear to the jury. So the American Stroke and Heart Association considers a retinal artery occlusion as a stroke event. Yes, not a stroke-like event, a stroke.
Okay, but there's no scans, and you've poured over many in this case, that show any sort of brain bleed or any issues besides the MPH and other issues that we've talked about that would be related to that stroke event. Is that correct?
Yes.
You poured over that he had any sort of NPH symptomology before the ski crash in 2016.
NPH symptoms are insidious at onset.
Okay, and what are those? I think they're called the triad sometimes. What are the three main symptoms of NPH?
So this is a very layman's way of explaining it, but you have cognitive deficits. You have imbalance, and that can lead to falls. And you have loss of the function of holding urine in your bladder.
So just to recap, the triad is memory issues, ataxia, and then incontinence is typically how that's diagnosed, correct?
Yes.
2016, correct?
Before 2009.
And what were those symptoms that you read?
Well, no, before 2009, that's correct. But yet it was commented on the MRI of 2009, and given that those symptoms are insidious in their onset, happening over years, maybe decades. 14 years later, I'm not at all surprised to find the plaintiff experiencing memory and loss of balance issues.
Okay. Did you review any of the MRIs taken of his brain in 2017 after the collision?
Yes.
And did those MRIs that you reviewed, did those show any sort of a worsening of this NPH?
They commented on it. I don't know if the scan showed worsening.
Okay, so you don't know one way or another if it worsened or not, but they did mention that that condition was present.
Yes, verified by.
But nobody had diagnosed his NPH before as having the triad that we talked about before. Correct?
I did not see any mention. Yes.
Okay. And you were asked a lot about plaintiff's medical conditions. We had a board up here. We had a whole list here. Did you read anywhere in the depositions that you reviewed that any of the laundry of medical issues that the plaintiff may or may not have had before the event kept him from being a world traveler or on the go or even skiing that day?
Earlier, he said to his primary care physician, "I feel like I'm getting old." That is most likely based on their of those various conditions do weigh a person both physically and psychologically.
Sure. But then if that is the case, Doctor, how do you reviewed some of the daughter's depositions?
The claim that there was not a transient decrease of function up to 3 months. But beyond 3 months at time, what decline he had was more likely than not already the ball was already rolling.
Okay. You testified earlier that you've been an expert in many cases that have gone on to litigation. Do you remember when you testified of that?
Yes.
Have any of those cases been ski crash cases?
No.
Okay. So this is your first ski crash related expert testimony?
Yes.
Okay. Do you know what confabulation is?
Yes.
And what is that? Will you explain it for the jury, please?
Confabulation means making information up.
It's not just lying per se, right? It's not just you're grabbing it out of thin air. There's a little bit more of a clinical definition for it. Isn't that correct?
I don't know where you're going with this.
Well, it's not just confabulation is an actual medical condition. It's not just creating lies, correct?
It can be related to a medical condition, yes.
Is it often seen in situations where people have had a brain injury?
Yes.
Okay. So inconsistent testimony by the plaintiff may be attributable to confabulation if his story is to be believed that he has a TBI.
So to point that symptom, confabulation, to the brain, alleged brain injury, sure, it's possible, but plenty of other things.
As you just said, correct. Is symptoms, the symptomology that you reviewed earlier, getting progressively worse from an actual imaging standpoint?
No, but we're talking about clinical diagnoses backed up,
But there's no physical, you can't point to any scans that say this is different than it was in those early scans in 2009.
Nor would I necessarily expect to.
Do you know what the medical term discordant means?
Yeah.
Okay.
We don't often use that.
Okay. And what does it mean?
Well,
You've been asked a lot about Mr. Sanderson's medical records and radiology reports that you reviewed. I'm going to show this first page of Plaintiff's Exhibit 6. Do you see this radiology report right here?
yes.
Okay. I'm going to zoom in here for all of us, and we'll just go. Do you read that paragraph that starts?
Demonstration of a prominent ventricular system discordant with mild cerebral volume loss and sulcal prominence.
Now, you have the degrees and I don't. So, does that mean that the prominent ventricular system, the issue with that ventricular system that you described earlier, is discordant or not related to or different from the mild cerebral volume loss with sulcal prominence? Is that what that means?
So I don't so suggest, but that is a valid conclusion. So
that's my layman's approach of reading a medical record, and I recognize you have that, and I respect your position. But the medical before describing this ventricular issue that you described earlier, isn't that correct?
I think we're talking about two separate things: the enlarged ventricles, and as a separate issue, the mild cerebral volume loss.
Okay. And short of going well beyond both of our expertise and sounding more like an idiot than I'm sure I already do, I think we'll leave that one there. Conditions that you describe. Is it also within the possibility of medical certainty that you've offered your opinions that Terry Sanderson's condition could be in fact related to post-concussive symptoms?
That is not what the medical literature shows.
It is possible, correct?
As far as anything is possible, yes.
Okay. Thank you. Let me just check with co-counsel, and I think that's everything I have for you. So if other witnesses reported massive changes directly at the aging process.
Restate the question.
Sure. Report massive changes in the plaintiff after the ski crash of 2016. Would you also attribute their discussion of those massive changes to regular aging?
This is a complex question. He had fractures. He had psychological and physical symptoms that do influence, a patient's global functioning. Rib fractures healed. Bumps and bruises heal. What we're left with long term, so I don't disagree with the fact that people around the plaintiffs said that the injury, but there was brain-related issues should have resolved within weeks to a few months. And what we're left with is a 69-year-old at the time brain with multiple problems.
Sure. But looking over the medical history like you did, you see that Terry Sanderson continued to try attributed to be fairly related to this accident, correct?
I would say that medical attention-seeking behavior started before, and evidence by his primary care physician visit the week, the 3 weeks, and that was likely a ball that was already rolling.
So he was interested in his health before the ski crash. You've testified to that, correct?
Yes.
So he would be very interested in anything he viewed to be very acutely changed. Isn't that also correct?
Yes.
So it would be part of that pattern to continue going to the doctor a lot up until you think that you're going to get some sort of resolution of your symptoms. Isn't that correct? Thank you very much, doctor. I appreciate it. Help from the back here. Last question.
To base a opinion on that.
Mr. Owens?
I'm going to read you what you told me your opinions are on redirect or on direct, and then I want you to tell me if anything has changed as a result of cross-examination. Lost consciousness only momentarily, if at all. Is that still your opinion?
Yes.
Plaintiff's post-collision neuropsychological evaluation shows none of the plaintiff's medical records support his claims that perceived symptoms of cognitive decline are related to the ski collision.
At this point, yes.
Another way of saying that is all current symptoms are explained by his pre-collision aging and degenerative disease.
Overruled?
Much more likely than not, yes.
And you were asked about a new word. Confabulation, like lying. You were asked about that, right?
Yes.
In order to get money.
Beyond the That's scope. not an evidence. That's not an evidence.
It is
Overruled.
And that he seeks attention, and that the notoriety of this case makes him feel powerful. Did you read that?
I did.
And on our little break, you said it's outrageous. You said something was outrageous, that they would assert something.
What's taking my words very wisely.
Thank you.
Evidence and the psychiatric evidence have evidence to support that when a concussion like this alleged concussion lasts over months, there is a high concordance rate with the patient being involved in litigation and also media attention. Both
beyond the scope of his proffered testimony.
Overruled. Just how he explained the post-accident.
Both of which are very real. Very real.
What is hyper-real? I missed it.
So it's just a colloquial
term
for extremely, so extremely real.
What is, again, extremely real?
The factors of this litigation and the factors of the media attention around.
So what of those things is hyper real? What are they doing to him about his current symptomology?
Well, so
I'm trying to understand this response, Your Honor.
Overruled. It goes to the weight.
You got to dumb it down for me, please.
ever televised in Utah makes it
I'm trying to understand his comment.
Maybe you could go into a little bit more of the background behind this opinion?
Yeah, I'm trying to understand the point you're making, and then what it's based on. So you're saying this very litigation and the media attention is impacting Mr. Sanderson. Is that your opinion?
Overruled as a preface to the question?
absolutely.
Okay, and then how?
So the litigation, so a lot of money is in play here.
And how is that affecting Mr. Sanderson's symptoms?
Foundation, Your Honor.
So I'm being told to sit down. Have a nice day.
Mr. Sorensen?
Just one question for you, Doctor. Is hyperreal a medical term?
No.
Okay, so that's has no basis. But again, you never conducted your own psychological evaluation of the plaintiff, correct?
No.
Okay. So that would be pure speculation about his motives or anything like that.
Based on a number of studies and meta-analysis of cases similar to this.
So case studies, but nothing directly attributable or applicable to Dr. Sims.
Case studies. Meta-analysis of actual things that are in the medical literature.
Great. Thank you very much.
Okay, you may step down.
Definitely, let's take our last.
Okay, we'll take a short recess. Short recess, thank you.
With a plan for Carrie Oaks,
Good,
I guess I'm going to be Carrie Oaks.
okay.
We just have to figure out who on our side is going to read the questions. Because there's only one additional question that was added by Wayne Owens, we're just going to have the same lawyer read all of the questions. So I'm just Carrie Oaks.
So Noreen could do it.
Well, that's what I had asked.
You good?
Or
Sure.
Bob.
I think it's nice to have both. Of one member from each team.
You guys decided that. To read it.
So I have the hard copy. Are there any objections?
I don't think there are on the mark.
Okay, I'll follow along if you'll
Yeah.
key me in on where you're at.
Yeah, there's some like objection calls for speculation, but I think we're good with everything.
Okay, thank you. We're taking a short break before you begin.
Your Honor,
Yes.
one other thing on Dr. Richard Bain on rebuttal. We don't know this yet, but we would like to propose that to hit Dr. Bain, and if it's okay with the court, that we have him testify at 9 or even 8:30, 8:45 Thursday morning for a very short rebuttal.
Can we deal with this at 5?
Let's do it at 5. Thank you.
Well, it's hard for us to propose it if it's not approved, and,
You mean he's waiting for the review?
well,
That's part of it, Your Honor. He's
yeah,
trying to
this week
schedule
is
it.
his wedding. He had an emergency medical procedure.
Is his wedding?
His
His
daughter's
daughter's
wedding.
wedding.
Oh, okay.
His daughter's wedding. He had an emergency medical procedure. We notified the opposing counsel about 3 or 4 months ago that he couldn't do his attend trial, and so
Well, I'm not sure when your rebuttal case is, but if that's when your rebuttal case is, that's fine. We can come a little early on Thursday. If that's not when you're,
Deal with this at 5?
Yeah, we can do
I'm
it.
not in the zone.
getting back to Carrie Oaks, the witness.
based on the time of the questions that they asked.
Well, if you want to just let us do our 15 minutes, and then we'll do it.
This council,
Noreen has a comment in response to that.
Yeah, so this is not going to take us 45 minutes to read the portions designated.
so let's be able to keep track of the time.
Oh, we didn't do that. We just marked jointly minutes of the 15.
Total. Are you fine with 5 minutes? Okay. Then 5 minutes of the time will go to the defense and the rest will go to the plaintiffs.
That's good.
Okay, I wasn't involved in theirs.
All right. Thank you.
Thank you, Your Honor.
matter, Your Honor?
Let's wait for the other side. Are we on the record?
Yes, we are.
Okay, we're back on the record. Council are present and parties are present. Mr. Owens?
Yes, thanks. So we're thinking this Carrie Oaks is going to go about a half hour, and then we're trying to figure out how to best use that other half hour.
Sure.
One option is, well, here's the question. How strictly left?
Strict.
Strict.
So when you run out of time,
Okay, so,
and I'm trying to be mindful of the jury.
so depending how much time is left, then we'll call Terry Sanders back to the stage, back to the pulpit.
No, I think not. The lawyers will point out any errors in your reading.
It's better than swearing at you.
What page are we starting on?
So,
We are starting.
funny thing.
Okay. Okay. Right, thank you. Who's doing the questioning, Ms. Abarama? Okay.
Use your deepest voice.
I can do without the commentary. Thank you.
Don't make objections.
Thank you. You may be wondering why Ms. Van the witness. We are now going to read a deposition, old school style. So the witness name is Terry Oaks.
Carrie. K-E-R-I.
Thank you for that correction. It's listed two ways in here. Carrie Oaks, and the person that will be reading Carrie Oaks' part is Ms. Kristen Van Orman, and the questioner will be Ms. Abarama. You may proceed, starting on page 6.
Judge, would you like me to state the page 6? Good morning, Miss Oaks. Could you spell your name for the record?
Yes, it's K-E-R-I, and Oaks is O-A-K-S.
And do you know about what year you started working at Deer Valley?
It's page 12, Your Honor. 1990. Actually, that was a couple, about that.
Now that we're talking about the incident that occurred on February 26, 2016, involving Gwyneth Paltrow and my client, Terry Sanderson. Is that clear?
Yes.
Okay, now I would like to go through some of the parties to the case. Do you know my client, Terry Sanderson?
Not beyond seeing him on the Hill that day.
Okay, have you had any other contact with him prior to that or subsequent?
Where I spoke with him, or no?
What about Gwyneth Paltrow? How long have you, or before this incident, do you know Gwyneth Paltrow?
That may have been the first time that I skied with her family. I don't recall exactly how many days I skied with them.
Page 18. Okay, 1 or 2 ski trips you've skied with Gwyneth Paltrow, correct?
Correct.
Sorry, if you could speak up.
Correct.
Ski ski crash?
In what capacity?
I mean, did you meet him?
Yes, we met him.
Okay, and I understand you were teaching primarily one of the children with some of the children. Is that correct?
Not his children.
Okay, whose children? You didn't ski with Brad Falchuk or the children on the trips where Miss Paltrow was not there, correct?
Correct.
Did you know who Greg Ramon is?
No.
Do you know who Eric Christensen is?
Yes.
How do you know Eric?
Through Deer Valley, we work together.
How long have you known Eric?
Since, I don't know the exact amount of years, but most of the time that I've been an employee here, I've known him. In particular? What in particular?
Anything about the collision with Miss Paltrow and my client, Terry Sanderson?
A relief that everybody was safe.
And who was everybody?
Everybody, meaning both people who...
Miss Paltrow and Mr. Sanderson?
Yes.
Page 53. What was happening? Had you all met at the top of Flagstaff Mountain, for example?
Yes, we got off the chairlift, decided that we were going to go down to lunch, and...
Can I interrupt? When you say we got off the chairlift,